Let's start our two cases to compare. The first case, 46-year-old male, history of injury on dry ski slope, and now he is unable to weight bear. History of trauma, and now he is unable to weight bear. Okay. First finding, there is a fracture of the lateral tibial plateau. Can you see the fracture here? Fracture, there is a fracture of the lateral tibial plateau. As you know, the tibia has medial tibial plateau and lateral tibial plateau. So the fracture here is in the right lateral tibial plateau with a fat fluid level in the suprapatellar bursa. With a fat fluid level in the suprapatellar bursa. Can you see this? This is the fat signal, and this is the fluid signal. So here there is a fat fluid level. And a fat fluid signal or a fat fluid level in the suprapatellar bursa. This is seen in the lateral view. Due to associated lipoheme arthrosis, this is called lipoheme arthrosis. So this is blood, this is bleeding, okay? So this fluid is blood, okay? And this is the fat in the suprapatellar bursa is elevated by blood collection here. This is called lipoheme arthrosis. So the diagnosis here, lipoheme arthrosis due to lateral tibial plateau fracture. Lipoheme arthrosis due to lateral tibial plateau fracture. I would recommend orthopedic review, and this patient may need CT scan. CT scan to evaluate the lipoheme arthrosis as well as the fracture. The second case here, 51-year-old male, recent arthroscopy. So he has a history of recent arthroscopy and now painful knee. So this patient has a painful knee joint after arthroscopy. There is a possibility of infection here, okay? This is the patient here. First finding, moderately severe degenerative change at the knee joint, most marked at the medial compartment. This is the medial compartment, okay? Moderately degenerative changes seen mostly at the medial compartment of the knee, where there is joint space narrowing, periarticular sclerosis, and marginal osteophytosis. As you can see here, there is joint space narrowing, subchondral sclerosis, and osteophytosis. Can you see the osteophytosis here? Osteophytes, okay? This means degenerative changes here. There is also a spiking of the tibial spines. spiking of the tibial spines. Spiking. This is the normal tibial spine. This is the spiking of the tibial spines. There is also, along with the moderate to severe degenerative changes at the knee joint, there is also soft tissue swelling anterior to the distal femur on the lateral view due to large joint effusion. Can you see here? There is soft tissue swelling seen anterior to the distal femur due to large joint effusion. So the fat signal here is replaced by soft tissue swelling. However, here the fat signal here is elevated by soft tissue swelling. This means there is a large joint effusion here. Large joint effusion, soft tissue swelling anterior to the distal femur on the lateral view. This large joint effusion could be due to infection. Regarding the history of recent arthroscopy, I will type this, regarding the history of recent arthroscopy. This large joint effusion could be due to infection or hematoma. This large joint effusion could be due to infection as a complication of the surgery of the arthroscopy. Could be infection or could be hematoma. So it could be infected fluid here or blood, okay, hematoma. However, here, regarding the history of trauma and the lateral tibial plateau fracture, the most common cause here is blood. This soft tissue swelling is due to blood collection. Okay. So we'll type this one here. Regarding the history of injury this soft tissue swelling is most likely due to lipohemarthrosis. Lipohemarthrosis due to lateral tibial plateau fracture. So there is another option here for this soft tissue swelling, which is infection regarding the history of recent arthroscopy. Management here, urgent orthopedic review and aspiration. So that's why here the management contains aspiration, because there is a possibility for infection. So aspiration is very important management option here, as long as there is a possibility for infection. However, here orthopedic review and CT scan. CT scan to confirm that this fluid collection is bleeding, to confirm hemarthrosis, to confirm the lipohemarthrosis. However, here the aspiration along with orthopedic review and CT scan to confirm the lipohemarthrosis. So that's all for these cases.